So, hi everyone. I'm Hetal Shah, Partnership Coordinator here at Outcome Health. I'm here today virtually with Dr. Suzet McKinney, CEO of the Illinois Medical District, for our Share the Scope campaign, where we'll be discussing health equity and social determinants of health. Over the past few months now, we've been listening to our Black friends, our Black family members, coworkers, and communities call attention to systemic racism, injustice, and representation. And here at Outcome Health, we've decided to address these issues head on. And one of the ways we can do that is by partnering with leaders and groups who are tirelessly working to affect change and advocate for equity and justice in healthcare. So thank you, Dr. McKinney, for joining us today. Can you share a bit about your background today for the folks tuning in?
Sure, Hetal, and thank you so much, and thanks to Outcome Health for having me today. As Hetal has said, my name is Dr. Suzet McKinney, and I serve as CEO of the Illinois Medical District. Just a little bit about my background. I am a native Chicagoan. I was born and raised on the south side of Chicago, specifically in the South Shore neighborhood. I am a product of Chicago Public Schools. I spent my high school career at Whitney Young High School on the west side of Chicago, and I returned to Chicago after college and began my career in public health just after the 9/11 terrorist attacks in 2001. I think one of the things that is so significant in terms of my background at this point, being a native Chicagoan, and since we are talking about social determinants of health and healthcare inequities today, one of the things that I would share with the audience is that I think my entire life we have heard this narrative about the South Side and the West Side being the two most vulnerable areas of our city. And again, that's been the narrative my entire life. I feel that now, as CEO of the medical district, someone who grew up on the South Side, went to school on the West Side, and now I'm working on the West Side, I feel so blessed and fortunate to have a platform in an organization like the medical district where my work can do something that will directly impact and improve the lives of our residents here in the city of Chicago, but especially on the South and West Side.
Well, thank you. And yeah, we're excited about hearing a little bit more about that. And thank you again. So, Dr. McKinney, you're a leader in the field of public health, and you serve on numerous boards. You've taught at Harvard, and you're the only Black female CEO of any major medical district in the country. It's an impressive record. And so we'd like to hear a little bit more about your experience as a Black woman and a leader in the field of healthcare. Can you share some insight into your experience and some of the issues that you faced?
Sure. Well, I think the first thing that I would share is that I have certainly had a fantastic career thus far. However, my career and my experiences have not been without its fair share of challenges. I think one of the things that I've been so fortunate to have along my educational pathway, as well as my career pathway, have been great mentors and advisors who have been able to walk alongside me as I pursued my educational goals, but also my career goals, and have helped me along the way. However, I will say that as a Black woman and a woman of color who sought to be in a leadership role, I have always felt that I had to work a little bit harder. I felt like I had to prepare myself more than my non-Black counterparts just to be able to reach the same level of opportunity and the same level of achievement that they had all reached. I have had situations in my career path where my abilities and my skills have been doubted. However, my choice is not to dwell on the negative experiences and instead to take those negative experiences and turn them into positive motivation, continue to propel myself forward, my career forward, but also to use them as learning opportunities, not just for myself, but for other young people, especially young women that are trying to come behind me in the field of public health, whom I might mentor or even just provide a little bit of guidance and advice to along the way. And so that's one of the things that I think has been a hallmark of my career, is that I have worked diligently to ensure that I don't allow negative experiences to discourage me in any way or to hinder me from achieving the goals that I've set out for myself.
Makes sense. And that's great advice. I think, we all could do that and think for the positive and look at that and focus on that as well. So thank you for sharing that experience. So many of us have seen the headlines and articles regarding, racial health disparities. And we'd love to hear your insight into what health disparities are and why they matter.
Sure. So the first thing that I would share is that health disparities are situations that occur when people don't have adequate access to health care. They don't have the same level of access that their non-Black or non-minority counterparts may have, and as a result, suffer increased inequities with regards to not just their health care and their ability to access it, but also their health care outcomes. It's similar to just not having the same level of opportunities that your non-Black counterparts might have. But with regards to health inequities, there are also a number of systemic issues that we see here in our country that contribute to health equities. So things like inequities in income earning potential, inequities in housing and housing stock, but also just inequities in terms of general economics and not having the same access to education and employment that our non-Black counterparts may have, which then in turn sort of create this snowball effect. And I often, when I'm talking about health inequities, I often use an anecdote about a mother or a father or a parent trying to put food on the table. That when you are concerned about where dinner is going to come from, that makes you less concerned about making it to your doctor's appointment.
Yeah, that makes sense. Thank you for sharing that insight. So let's dig a little bit deeper into, healthcare disparities affecting the Black community across the U.S. Can you share some of the top issues and health disparities affecting the Black community, both in Chicago here and then nationally as well?
Sure. I think the health disparities that we see here in Chicago are not unlike those that we see across the country. You've probably been hearing a lot about health disparities in the news recently because the COVID-19 pandemic has really highlighted the existence of these healthcare disparities. But traditionally, what we see among the Black community are higher incidents of chronic health conditions such as diabetes, heart disease. We see a lot of challenges with asthma, and those are the types of chronic health conditions that we are seeing in the Black community here in Chicago, and we're seeing them in other cities across the country as well. And I think, as I spoke about before, with regards to disparities in housing and not having access to the same types of housing that many of, our non-Black counterparts might have, contribute to many of these healthcare disparities.
Yeah, no, that makes sense. And, we see the disproportionate burden on, communities of color. And so it's great to hear that, it's being addressed. I mean, obviously not in the best way right now with COVID, but it's being addressed and it's shared. One of the things that we did want to ask about specifically are what are the key initiatives that you and your team are working on to address healthcare disparities in Chicago?
Sure. One of the major initiatives that we are working on at the Illinois Medical District is actually a partnership with Rush University Medical Center, the University of Illinois at Chicago, Health and Health Sciences System, and a number of other healthcare partners across the city. That initiative is called Westside United, and we have come together as a group of concerned healthcare organizations and community-based organizations. We're working directly with the community, but what we're doing is addressing what we call the social determinants of health. And we are addressing social determinants of health as a means to improve healthcare and healthcare outcomes and to begin to minimize some of the extreme levels of healthcare disparities that we see. So more specifically, what that work entails is really looking for opportunities and identifying ways to improve access to education, access to employment, and also perhaps even improving neighborhood infrastructure as a way to begin to address health outcomes and improving those health outcomes.
Well, thank you for sharing that. I'm glad to hear that. And, SDOH, social determinants of health, are one of my top things in my background in public health. So I'm excited to hear and see what's happening in Chicago. And for those of you who are tuning in who may be new to social determinants of health, these are conditions in the environment in which people are born, live, work, play, worship, etc., that affect health outcomes and quality of life. And these can include, like Dr. McKinney said, access to affordable housing, financial literacy, access to healthy, fresh foods, education, and even public safety. So Dr. McKinney, how are you leveraging social determinants of health in the fight to address inequality in healthcare?
Yeah, so one of the things that we are doing is really looking internally at our organization. And I know a lot of the other anchor institutions that are involved in Westside United are doing the same. But what we have started to do is look internally at our processes and our policies to see where we might be able to make modifications so that we can then provide greater opportunities to communities of color, whether those opportunities are related to accessing employment or accessing educational opportunities or others. And so I'll give you a specific example. One of the key activities in the medical district's portfolio of work is development of our district. And we are currently exploring real estate development within the medical district, but for the sole purpose of attracting private sector, healthcare, technology, and science-based businesses to locate within the Illinois Medical District. And so when I think about the social determinants of health, as I am talking to CEOs of businesses and companies that we're trying to attract to the medical district, I'm talking with them about the challenges with healthcare disparities that we are seeing on the West Side. And I am asking for their partnership. And I can recall one CEO of a private healthcare related company. I said to him, we need to identify opportunities to create jobs for West Side residents. Will you partner with me? And how can you partner with me? And he said, I'm happy to partner with you, but I need you to tell me how I can best do that to meet the need. So I asked him one simple question, and that was, are there any employment opportunities within your company that we can target to community residents? And if not, are there any training opportunities within your company that will eventually lead to an employment opportunity that we can target to community members? And he said, actually, there are. So one of the programs that he has within his company is he trains community members to become EMTs or medical billing and coding specialists. And he said, we'll conduct this training. We will open it up to community members. He said, and I will commit to training 100 community members. And for every single person who completes their training, I will hire them. And you know what?
Phenomenal.
He did it.
Oh,
and
that's great.
So for me and for my team at the medical district, that is one tangible example of how we are modifying our processes just a little bit with the social determinants of health in mind in a way that creates greater access and greater opportunity to the people who need it the most.
That's great to hear. And I'm so glad that you're doing this. And hopefully nationally people will take this and recognize this approach and use it across the U.S. because it's imperative that we try this approach. You mentioned before that we were seeing of, the COVID cases in African American or Black communities and Hispanic communities. So we've seen recent reports that Black and Brown communities are obviously disproportionately affected by this compared to other groups. And we know that you were recently featured on CNN to discuss this issue. We wanted to hear a little bit more from you about that. And if you can share with our audience how health disparities are shaping the impact of COVID-19, since it's affecting us all right now.
Absolutely. One of the things that I have been sharing and continue to share is that healthcare disparities, that's not something that's new. We've always seen disparities, particularly around the chronic health conditions that I mentioned. I think what we are seeing with COVID-19 is when you have someone who is suffering from heart disease, hypertension, asthma, or perhaps diabetes, and then you overlay a severe case of COVID-19 on top of that, what results is even more severe illness. There are a number of theories around which systems in the body COVID-19 affects, and I think the research there is still very new. So we don't have, clear scientifically based theories at this point around systems in the body that COVID-19 is affecting. But we do know that it does make for more serious illness when you overlay COVID-19 on top of some of these other chronic health conditions. What I will say, obviously, is because we see a higher incidence of these chronic health conditions in Black and Brown communities, I think that is really highlighting those disparities now in the age of COVID. But one of the things that I think is very clear to me, and what I hope policymakers and government leaders and other decision makers are beginning to understand, is that the problem that's amplifying these healthcare disparities today is COVID-19. But if we don't do something to address the systemic issues that led to the healthcare disparities in the first place, tomorrow it may not be COVID-19 that amplifies them. It'll be something else tomorrow. It'll be yet something else 5 years from now, 10 years from now, 20 years from now. So as a society, we really need to be doing more to address the systemic issues, as you mentioned, access to affordable housing, access to health care, and those other things that we consider to be along the spectrum of social determinants of health.
Makes sense. You can't really affect change if you don't address the root issues and the root causes.
Exactly.
So, many organizations and individuals are waking up to the systems and structures in place to disenfranchise communities of color. What has this current national reckoning meant for you, and what are you hoping to see come from it?
I think that what we are seeing nationally now is that businesses and companies and organizations across the country are beginning to recognize that communities of color, just as you said, are disenfranchised, and they're all looking for, ways that they can help. And I think that that's fantastic. But what I'm hoping to see come from it is not just a cookie cutter approach to solving the issue, or not just the type of approach that, could be seen as a Band-Aid, but really something that is going to be comprehensive and long-standing. In other words, not just lip service and something that we can talk about. I often talk about, a good friend and mentor of mine who specializes in diversity, equity, and inclusion. And she has a little saying that she always says, and that saying is, diversity is being asked to the dance. Inclusion is being asked to dance. But equity is being allowed to select the music.
I love
and
that.
The way that I interpret that in terms of the national reckoning that's happening right now is that as we see systems and organizations and communities working to identify ways to no longer disenfranchise communities of color, I think in terms of employment, you have to look at ways to bring in more people of color, not just within the ranks of the organization, but also in leadership, in the C-suite, but as well at the board level. Yes. And I think most importantly, there's a saying that we have in the emergency preparedness world that says nothing for us without us. These communities have to be included in these conversations, and they also have to be included in the decisions around new programs and new services and new offerings.
Makes complete sense. And I might actually steal that from you. So thanks in advance.
Right ahead.
As we wrap up today, Dr. McKinney, do you have any final thoughts that you'd like to share with us about, health disparities, social determinants of health, or creating opportunities for Black communities? I mean, I know you've touched on a little bit of some of the issues and the things that you think would work, but I'd love to hear a little bit more from you about this.
Sure. I think one of the things that I would say, and it sort of follows the same line of thinking with the comments that I just made about diversity, equity, and inclusion. I think as a society, for those of us who are leaders, we have to look within our organizations and identify systems and processes that we can use to identify talent, new talent, and create opportunities, not just for new talent, but also for existing talent, and identify mechanisms for promoting communities of color and those that have been disenfranchised. I think what's critically important is that first we have to all educate ourselves on what the issues are. And then we have to be intentional about our efforts to address those issues. I am trained in public health, and in public health, we learn that the secret, if you will, to tackling complex problems is to employ a systems approach. So this is not something that healthcare is going to be able to solve on its own. It's not something that government is going to be able to solve on its own. But it is something where multiple stakeholders and multiple disciplines and industries will have to come together. The private sector, the public sector, as well as the nonprofit sector across healthcare, education, policy, housing, law enforcement, you name it. But we have to be intentional about these discussions, and we have to operate from a position of knowledge, and that requires that we educate ourselves. And sometimes it'll be hard to hear the truth, but we have to be bold and we have to be courageous in that.
Thank you so much for sharing that. And it's everything that you said is true. And we're so thankful that you spent some time talking to us with this. We appreciate it. And we look forward to doing more work with you. So thank you again for taking the time.
Thank you so much. It was my pleasure. This has been the highlight of my week.
Oh, great. Well, for everyone tuning in, remember, follow us, on Instagram, follow the IMD, and look at the hashtag #ShareTheScope. Thank you, everyone, and thank you, Dr. McKinney.
Thank you.